answer your questions. Dr. Shira Daron, the hospital epidemiologist at Tufts Medical Center. Thank you so much for being with us.
Great to see you, Dr. Daron. Thanks for your time. So about half of American kids in this age group are fully vaccinated right now. So do you believe they need the booster shot as well?
Well, the CDC's advisory committee is still meeting as we speak, and the discussion is pretty heated. One question that just has not yet been established is what we want vaccines to do for us. Is it to prevent severe disease, or is it to prevent any infection? And I actually think the former is turning out to be more realistic. And so while I think boosters should be available to children over the age of 12, I'm not sure the recommendation should be that all children should receive a booster. I'd prefer that the wording be that these children may receive a booster.
Okay, I want to talk to you also about another virus that you're tracking closely, especially during the time that we're in, and that's the flu. Are you starting to see more cases at Tufts?
We're seeing a stable amount of flu since November, around 4 to 5% test positivity. But what's interesting is that while Massachusetts is reporting moderate flu activity, what could be affecting the numbers is that increasingly the PCR test kits that the labs use for COVID come with a flu test, even if you don't want one. So that's going to mean a lot of flu testing is happening when there's so much COVID testing happening, and a lot of flu diagnoses in people that wouldn't have otherwise sought a test.
Yeah, so let's continue that a bit. You've told us before it is possible to become infected with COVID and the flu at the same time. In fact, some experts have already created a name for it. They call it Flurona. So how common is it, and does it cause more serious symptoms?
We have not seen a case of flu and COVID occurring together here at Tufts, though I wouldn't be surprised to see it. We've seen other respiratory viruses occur in patients who also tested positive for COVID. And when we see that, it can be tough to know which virus is causing the symptoms, or if both of them are. Since we didn't have a flu season last year, we really need to see how these Flurona infections play out in the next few months.
That's a good point, yeah.
You know, we continue to get emails from some viewers who say doctors are being dishonest about the public's risk from COVID. I want to ask you this question. This one is from John. He says, why haven't you reported the thousands of cases in Massachusetts related to complications from the shots, myocarditis, aneurysms, etc.? Are you afraid to report them?
I think John has a point, which is that in order for the public to trust the information about the benefits of the vaccines, we also need to be honest and transparent about some of the harms of vaccines. And in the meeting today of the Advisory Council to the CDC, as in all of their meetings, which are open to the public online, the adverse events were very honestly discussed. But perhaps that doesn't make its way into the mainstream media. Now, with mRNA vaccines, the most concerning adverse event is myocarditis, or inflammation of the heart. And with the J&J vaccine, it's blood clots. And the advisory committee carefully weighs those risks against the benefits and bases their recommendations on those assessments. And in fact, in the case of the J&J vaccine, the committee did recently decide not to recommend the vaccine anymore unless somebody really wants it or needs it because of those risks.
Dr. Daron, thank you for your time. It's great to see you.
You too.